Serious. Doctors have read it. What is the rarest disease that you've encountered in your career? Don't forget to like, share, and subscribe. Rare and interesting would be pentology of Cantrell, which has the heart outside of the chest because the sternum has not fused. I'd seen it before with just a bit of the heart on view, but with this kid it was completely out. You could see pretty much the whole heart with the aorta and lung vessels, all that was holding it. The heart just beating away. I'd done adult cardiac for a bit, but this was a little different. Tiny. We covered it with a polystyrene cup until the kid went or theater to have it pushed back inside. It's meant to be 1 in 65,000 live births. Anti-NMDA receptor encephalitis, 1 in 1.5 million. Psychotic symptoms, auditory or visual hallucinations, paranoia, delusions, due to an autoimmune disorder where your body produces antibodies against NMDA receptors in your brain. We've seen 2 this past year at our hospital. The real incidence of this could be higher than 1 in 1.5 million, but might not be tested for often enough. Once someone gets labeled a psych patient, consideration of medical etiologies often goes out the window. The rarest I've encountered is KID syndrome, Keratitis Ichthyosis deafness. A 5-year-old, very sweet blind girl who literally had rough, thick, opaque skin on the surface of her eyes. Pseudocyesis, or hysterical pregnancy, in a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus' triplets and had grown a massive, pregnant-looking belly, was producing milk, etc. Numb chin syndrome. I was just a third-year med student shadowing the respiratory team at a small suburban hospital. RESP were post-take, which meant that any medical patients that came into hospital over the weekend were their responsibility until they could be referred to a more appropriate specialty. Massive list of random people to see. Ward round was going to take all day. Intern says there's a guy who stayed in A&E overnight with jaw pain. Why does he need to be in hospital? So I get sent to go do a basic assessment in the hope that we can discharge him before it gets late. When I found him, he looked fine, just sitting on the edge of a trolley. Turns out, he was in his garden the previous day when he suddenly felt a really sharp burning pain in his chin. He specifically said it was on the left side of his chin, and he initially assumed he had been stung by a bee or something. But there was absolutely no redness or swelling to be seen, and after a couple of hours, the burning feeling turned to pins and needles, and now he couldn't feel anything at all. I hadn't a clue what was going on, so I just went through the motions of taking a full history. He felt completely well except for this numb chin. Being a student, I got my tendon hammer out and subjected this poor guy to a whole neurological exam. Everything was normal except for numbness, which was entirely isolated to the left side of his chin. My priority at the time was not looking like an idiot when I went back to present my findings to the intern. So I came up with some bullshit about how each side of the chin is supplied by the mental nerve, an unimportant branch that runs through the jawbone and pokes out of a hole to supply the skin just over your chin. The stressed out intern rolled their eyes at my esoteric anatomy lesson and told me to try to come up with some diagnosis so we don't both look hopeless in front of the boss. I literally Google numb chin syndrome on my phone. I was surprised to find it was actually a thing. But the only search results are random case reports from decades ago. The main cause seemed to be idiopathic, i.e. we don't have a clue either. But there was 1 or 2 cases where the patient happened to have leukemia. I mentioned this to the intern in a vain attempt to claw back some brownie points, but I didn't expect him to stop and look at me. It turns out that the guy's only past medical history was that had leukemia years ago and had been in remission for so long that they hadn't even mentioned it to me. TLDR. So it turns out the numb chin was a really rare sign that their cancer was coming back and had deposited in the narrow bony canal where the nerve to their chin lives. The patient ended up staying in hospital, was reviewed by a neurologist, and then referred to oncology to restart chemo a few days later. I've been a doctor for a few years now, and I still don't think I've ever made a reveal that tops that. Gorham's disease, aka Vanishing skull syndrome. A softball-sized area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brain. Crazy disease. We had a patient once, a young girl, who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using two metrics. The sample was considered female if it 1. Lacked Y chromosome and 2. Was heterozygous on X chromosome, implying there were 2 copies of it. Otherwise, the sample was considered male. This one sample registered as female on metric 1, no Y chromosome, but male on metric 2, very little heterozygosity on X chromosome, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turns out that the parents of that poor girl were brother and sister to each other. As a result, she had very little genetic variation throughout her genome, not just X chromosome, and was consequently very sick with a plethora of diseases typical for a consanguineous birth. Harlequin Ichthyosis. In med school, there was a baby born with this. Basically, their skin scales up and peels, removing that very important barrier, so kids born with this don't live long. She was just a couple of months old and had not yet left the hospital since birth. Fibrodysplasia ossificans progressiva, FOP, a disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections, we sometimes would get poked by spiky pieces of bone in random areas of her body. Also, had a spine that resembled a small turtle shell. Wow. I'm a PAC, not MD or DO. I work in psychiatry. Had a patient who came to me with worsened depression, anxiety, insomnia starting 4 months previous, in part related to recent increase in environmental stressors. Started them on antidepressants, they responded well, even started eating healthier, exercising on a regular basis, and stopped smoking. They show a follow-up. We get an automatic refill request from the pharmacy a few weeks later. Call and get them rescheduled. My patient makes it to that appointment, sits down and says, "I have to be honest. I don't remember you, or why I was coming here. I can't remember the last 6 months." They ended up in the ER acutely ill, fever, confusion, pain. Later, they were diagnosed with aseptic meningitis, which had injured the brain, resulting in an amnesic episode. The patient had seen several specialists, including neurology, infectious disease, immunology, and most had come to the conclusion the antidepressant had been the trigger for the meningitis. At the time, there were 2 documented cases of a similar nature. The patient ended up becoming a case study. Upside, they were no longer depressed or anxious. Downside, they were back to smoking and having a less healthy lifestyle. Brazilian doc here. I live in a really poor part of an already poor country. When I was in my pediatric internship, there was a baby with hepatomegaly, big liver, in my region. The first thing that you have to think about in these cases is a disease called Kala-Azar, also known as black fever or visceral Lysominosis. It is an endemic disease, which there is a parasite transmitted by a mosquito that can infect people with compromised immune systems, like people living with HIV and kids. This parasite infects the bone marrow and simulates clinical signs of acute leukemia, like chronic fever, spontaneous bruises, and bleeding. The patient develops anemia, leukopenia, low white blood cells, and low platelets. To compensate, some organs like liver and spleen take care of the bone marrow function to create new blood cells and thus get bigger. This disease is really common in my region, but really rare in other parts, especially non-tropical countries like the US. Anyway, as I was saying, this baby girl, about 1 year old, was admitted to investigate a hepatomegaly, but the catch was that she kept having those episodes of hypoactivity and sleepiness, and sometimes even fainting that would get better after she was breastfed. We then checked and saw that she was having lots of hypoglycemia episodes. Her lab was normal, and she had no other clinical signs that would remind her of Kala-Azar besides the hepatomegaly. The patient had a HERS disease, a genetic disorder that makes you produce less glycogen due to an enzyme defect. Never heard of it before meeting this patient, and I think I'll never will meet other one. Interestingly enough, in the same time, I had a patient that was admitted with leukopenia, anemia, and low platelets that was also hospitalized to rule out Kala-Azar. But he actually had Fanconi anemia, and also really rare genetic disease. In this one, the bone marrow slowly stops producing blood cells. Besides this, the patient also has kidney, facial, bones malformation, and overall physical underdevelopment. Walking corpse syndrome, Courtard delusion, 17 years in mental health, and I've seen it once. The belief that some or all of you is dead. The guy was so certain he was dead, he believed he was a zombie. Maybe not the rarest, but saw a 4 to 5 year old patient with Lysominosis syndrome on my peds rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is, for whatever reason, these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad, but definitely one of the more memorable cases from med school. On my OB rotation during ER residency, I helped deliver a baby who had spots all over. Further blood testing revealed the baby had developed leukemia while in the mother. Didn't know that was really possible prior to that day. Incredibly rare. My colleagues had a patient with a catecholamin-induced ventricular tachycardia, aka every time this 13-year-old exercised vigorously or got too scared, the adrenaline would induce a deadly arrhythmia that needs to be shocked before long in order for him to survive. Seriously. Objective tinnitus. I could lean close to the patient's ear and hear a ringing noise coming out. Central deafness. Patient had an anoxic brain injury and was essentially deaf, even though there was nothing wrong with his ears. Neurologist here. We see a lot of weird stuff. Autoimmune encephalitis, brain on fire, late onset familial neuromuscular diseases, rare presentations of cancer, or paraneoplastic disorders. But one rare one sticks out for me. We had a patient who had come in with confusion and aphasia, trouble speaking and understanding. We got more of a workup and saw small strokes all over, but in peculiar distributions, and not ones that would explain his findings. Along with it, we saw microbleeds all over superficial parts of his brain. Turns out, he has what's called cerebral amyloid angiopathy-related inflammation. It's an extremely rare inflammatory subtype of a stroke disorder that we still aren't totally sure what it is. It has similar amyloid deposition you see in Alzheimer's, deposited around vessels, which makes them weak and prone to stroke and bleeding. It causes rapidly progressive dementia. I presented the case to our department, a large academic center, and most had never heard or seen it in their career. A couple of the stroke doctors were the only ones who knew about it, and they'd never seen it. Really interesting case. Malignant hypothermia in my 11-year-old patient. I was only in my second year of anesthesiology residency, and I thought she was going to die. I had a salty old anesthesiologist as my attending, and she calmly led the whole team through the treatment. My patient did great, and her labs were all normal when I took her to the peds ICU. I couldn't sleep for 2 nights and still haven't gotten over it. Patient admitted for something unrelated, starts deteriorating for no discernible reason, has some mild generalized abdominal pain, but other than that, no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast CT, there's fluid everywhere, organs pushed against the abdominal wall, just one enormous gray puddle from the top of his pelvis to his diaphragm, and then at some point, there's a scribble of white, pretty much smack dabs in the middle of it all, in this context signifying active bleeding. It was shaped like the world's smallest firework pop, and it was nowhere close to any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous, atraumatic rupture of the cystic artery. No surgeon in the building had ever seen one. Dude underwent embolization and made it out completely unscathed. Persistent genital arousal disorder, Having multiple orgasms a day at any time without any stimulation becomes quite bothersome and uncomfortable, limits your daily activities, and sleep is interrupted. Over time, patients can become very hopeless. It is remarkable the dissonance between the name and the obvious joke, and the tremendous suffering these patients endure. Geneticist here. I work in a pretty big hospital, and we get hard-to-solve cases from all over the world. Some of the cases are so unique there's literally no name yet, the genetic disorder. So those would be the rarest, but for the sake of this thread, I'll discuss something that is not the rarest, but is pretty rare and one of the most interesting. Prader-Willi, or Anglem Syndrome. These are two extremely different disorders that are both caused by the same exact genetic mutation. The only difference is if the mutation occurred on the paternal chromosome or the maternal chromosome. If it occurred on the maternal chromosome, you get Anglem Syndrome, which typically results in the child being overly happy, laughing all the time, with light eyes and hair color, but also severe intellectual and physical disabilities. If the mutation occurred on the paternal chromosome, you get Prader-Willi syndrome, which results in the child having excessive hunger and can literally eat him or herself to death, but with only mild cognitive disability. These kids may go a very long time not getting diagnosed and will become quite obese. Bonus disorder, if you're still here, Williams syndrome. With this one, the affected individual has an extremely charismatic, outgoing and fun cocktail party personality. They are cognitively impaired in most aspects except for speech and have very unique facial features that are described as elf-like.